My name is Michael Battelle, and I'm the president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with NAFLD and NASH by advocating for access to approved treatments and care. Today on our FLA Fireside Chat, we have a very special guest, Dr. Maitreyi Raman. She's a gastroenterologist and physician, nutrition, and lifestyle medicine specialist, and associate professor of medicine at the Foothills Medical Center in Calgary, Alberta. And she's the medical director at the Southern Alberta Home Enteral and Parenteral Nutrition Program. Dr. Raman's here to talk about an innovative solution that she and her team have developed called LyfeMD. It's an app developed by health experts for anyone living with irritable bowel syndrome, inflammatory bowel disease, including Crohn's disease, ulcerative colitis, inflammatory arthritis, and other inflammatory conditions. And what we'd like to talk more about today specifically is the application for non-alcoholic fatty liver disease. Dr. Raman, tell us what exactly LyfeMD is and why you developed it.
So thanks for the question, Mike. So LyfeMD is a digital mobile application solution that's designed for any patient living with digestive diseases to improve their symptoms, their overall outcome from their disease, and their quality of life. Now, specifically for non-alcoholic fatty liver disease, NAFLD, the application really is there to support patients during their diet and nutrition and weight management journey. And it supports patients by giving them specific ideas and programs that is personalized to their to where they're at in their journey. And not only does it come with diet and nutrition and physical activity programs, it comes with a full behavior change toolbox to help lead to success. We know that from the literature that weight management, and particularly not just weight loss, but maintenance of weight loss is very, very challenging. And a lot of those challenges occur because of typically our environment. So there's lots of things that influence the weight journey, including one's genetics, their environment, and the brain biology. And I find the brain biology absolutely fascinating because if we understand the brain biology and how it leads to weight gain or difficulties with weight loss, we can specifically target the brain biology using behavior interventions and behavior solutions to help with that journey. So the LyfeMD NAFLD application specifically, its secret sauce, I would say, is to really address the brain biology to help with the weight management process.
It's incredibly challenging for patients, to lose the weight. I think it's only about 10% that can actually achieve that in a year, and you can correct me, and about 10% of those can actually maintain that. So it's very few people that can actually in a healthy way reduce their weight or their BMI and maintain it, right?
You're absolutely right. And specifically for NAFLD, we know that oftentimes in the clinic, we'll toss around numbers and we'll encourage people to achieve 5% weight loss. And if possible, we'll aim for 10%, if not more. And those numbers really come from the effects on the actual liver. So with a 5% weight loss, we can see some improvement in the amount of fat in the liver. So the actual fat quantity decreases with 5% weight loss. But really, what is really important, I think, to the fatty liver outcome is what is the effect on scarring on the liver? So if there is fibrosis, mild fibrosis or mild scarring, we know that the amount of weight loss needed to see some improvement or regression on the scarring is a little bit higher. So typically, we would now be looking at a minimum of 10% weight loss in order to see that improvement in scarring. And that is really challenging to achieve. So programs that are supported with behavior change enhancements are really critical to having success in the field. But even just to quickly diverge from this topic, this is exactly why many of the major guidelines and major liver professional organizations have now even recommended specific types of diets rather than absolute weight loss as a method to achieving improvements in the liver fat and scarring. So the Mediterranean diet, for example, most people are likely familiar with this in some capacity, has now in fact been the primary objective or the primary intervention of choice that liver specialists and gastroenterologists are recommending to patients, even as first line beyond the need for weight loss, simply because people can typically change their diet to reflect a Mediterranean type of diet. And that is likely simpler than the tall order of asking someone to achieve and maintain 10% weight loss.
You raise a lot of really great points. The ASLD just put out their guidance statements too and spoke about healthy eating. Low carb was one of the things that were discussed, as well as healthy, like the Mediterranean diet as well. And in fact, they also talked about coffee. So I don't know if your app also goes into that, but they said at least 3 cups of coffee a day. So I don't know if that's something in your app as well, but
Right. And you raise some interesting points around coffee. We haven't necessarily gone that route, largely because, coffee and its role on the liver, as you describe it, there's definitely data for its benefit. But, as a gastroenterologist, I also see the complications of coffee from a symptom perspective on various other things. So I think we haven't included that in the application, but to your point, it's something that for a coffee drinker, likely the message is they probably shouldn't stop.
and one more message, not to add a lot of cream and sugar. So
Very true.
most people don't drink it black, so that might be more of a challenge too. Yeah, one of the other things was alcohol that was mentioned, by the way, too, that in some patients, it's not just reducing alcohol, but eliminating it depending on how severe their disease is.
Absolutely.
I wanted to ask you too, so would you say in the patients that have utilized the app, you've seen, and maybe it hasn't been long enough, but have you seen an improvement over the norm, the control, if you will, of patients who don't have ability to use the app?
So you raise a really good point in that for patients with fatty liver disease, we have not yet studied this in the context of a randomized controlled trial. But what we have seen, so we have about 100, maybe just over 100 patients that are using the application specifically for NAFLD. In total, there are over 600 users for other conditions like Crohn's and colitis, like you've mentioned. But specifically for NAFLD, in the 100 users, we're seeing some very interesting results. Patients are coming back. They have been able to change the quality of their diet. They feel almost 100% of patients who have used the app feel that the application has provided them with some behavior change tool that they were not aware of, that they've been able to implement successfully into their overall diet and lifestyle program. So whether that is a better understanding of how to implement the Mediterranean diet, whether it's an understanding of the types of physical activity, the quantity of physical activity, or even the mindful eating programs, especially when binge eating or emotionally driven eating has a role to play in making those choices. A lot of people have a lot of positive things to say about how this has allowed them to sort of thrive on their weight loss journey.
I thinking about two things. The first one is that in a way you're supporting that multidisciplinary approach because behavior is clearly important. And that's why the program that you have, the app, is working in the patients that you have. So we're in early. It'll be great to follow up in a year, and when your numbers grow and come back and talk about that also. Yeah, anything else that you wanted to share? Oh, I wanted to ask you too about how can people actually get the app if they want to check it out?
Right. So they can download it or from either the Apple Store or the Google Play Store. And if people are interested to try it out, they can actually email me individually, and I will supply them with a code to access it at no cost to any patient in Canada.
Okay.
And I know this is sort of after the fact, but I did also want to emphasize that there's a lot of interesting emerging data for intermittent fasting to help the NAFLD patient with weight management, as well as with improving some of that visceral or central adipose tissue. And the application has a nice section for those individuals that are keen on alternate approaches to weight management, including items like intermittent fasting.
And one more, you didn't mention yoga.
Absolutely, you're absolutely right. So there is a full yoga, breathing, and mindfulness program in the application as well. And this is kind of the area that the mindful eating programs fits in. So for individuals that may have joint pain or low back pain or other factors that really limit their ability to engage in physical activity, the yoga program is a nice gentle movement program that most people can engage in very successfully.
Well, that's great. Thank you so much. I can't wait to talk to you again. And we'll hear more. Maybe we can even get a couple of the patients that utilized it to hear their comments about it. That would be kind of neat. So thank you very much. And I'm looking forward to follow up on that. Thank you.
Thank you.